The B52 is a medication cocktail that is often used to sedate agitated patients. It's comprised of 50 of Benadryl, 2 of Ativan, and 5 of Haldol. So that's an antihistamine, anticholinergic medication, a benzodiazepine, and an antipsychotic. Haldol ideally decreases psychotic agitation, and because Benadryl is anticholinergic, it theoretically prevents side effects such as acute dystonia from the Haldol. Ativan, of course, is a benzodiazepine, which will just make you feel sleepy. This combination is preferred because it ideally sedates someone without affecting their respiratory drive, as loading someone up on a benzodiazepine alone would. We have GABA activity, we have histamine activity, we have anticholinergic activity, and we have anti-D2 activity. So we sprinkle across all the receptors without hitting one way too hard. Which leads us to the cocktail's namesake, the B52 Stratofortress Bomber. The metaphor of bombing someone with medications I don't like too much. It feels a little violent. I think earlier, even this year in my career, I was more okay saying it, but I don't really like the optics of it too much. Also, in general, I find that 50 of Benadryl, 2 of Ativan, and 5 of Haldol is a bit overkill for most situations, and I would prefer to just give someone the minimum amount that I think they would be able to tolerate and come down from whatever situation they're in. This is especially true in older patients where antipsychotic use for agitation increases the risk of death by 60 to 70%. I think I read somewhere that the number needed to harm giving an antipsychotic to a geriatric patient is about 40. And the rate of accidents for base jumping is about 1 in 40. So anytime that I have to convince myself to be willing to give a geriatric agitated patient antipsychotic, I, in my head, make the analogy that this is like their base jumping. So it better be worth it.